Hello, everybody, and a warm welcome to you all. Thank you so much for making time to join us today as we discuss today's topic. So, today's topic is rather a common occurring, yet very few of us would actually understand why or how it actually happens. I'm sure some of us have either seen it, read about it, or actually living with it in our homes. And this condition affects mainly babies within the age ranges of 0 to 5. And this is cerebral palsy. So now the question is, what is cerebral palsy? Well, cerebral palsy is, in simple terms, damage to an immature brain or damage to a brain that is still developing. Now, how does it happen? So there are three main ways in which cerebral palsy can occur. It can either develop before the baby is born, during the birthing process, or after the baby is born. So now, before the baby is born, several factors can come into play that would actually put the baby at risk of developing brain damage. Several factors such as the mother's age. Research has shown that in very young mothers, as well as the very old mothers, children born out of these are at a higher risk of developing cerebral palsy. Not that every child born from these two age group mothers would have cerebral palsy, but that the risk is higher in these two age ranges. Okay, another one is the health of the mother. For instance, if the mother's health is maybe she was ill during pregnancy, that illness goes to affect the unborn baby. Imagine this time when the baby is still in vitro, the baby is still new, so it's not used to any disease, it's not used to any trauma or insult. But then when the mother's infection penetrates and goes through to attack the baby's brain, the baby's brain may actually be damaged and end up being born with cerebral palsy. Another factor could be the social behavior of the mother. If the mother, for instance, consumes too much alcohol, that could also damage the unborn baby. Fast forward, during the birthing process, several factors can also come into play that will put the baby's health at risk, such as maybe the baby is too big to pass through the birth canal. One. Number two, maybe as the baby is being born, the umbilical cord ties around the baby's neck, thereby strangling the baby and making the baby fail to breathe. Number three, maybe as the baby is being born, there's so much fluid, the amniotic fluid, uh, that was in the womb comes and the baby inhales it. So the baby kind of drowns in that fluid. And if the baby drowns, chances of oxygen levels going to the brain will reduce. And that could also put the baby at risk of developing brain damage. The other cause could happen after birth. Now, after birth, several factors can um, lead to a baby developing cerebral palsy. For instance, illness. Again, illness still comes even after the baby is born. So, if the baby is exposed to an illness that penetrates the brain, that could damage the brain, thereby causing the baby's brain to have some delay in executing the normal activities that a normal child or an unaffected child performs. Um, get me clear, I wouldn't want to use the terms normal and abnormal, but I'm going to be using throughout the topic, I'll be using the terms affected and unaffected, because even the baby who is affected is normal. It's just that the the what can I say? The, some functions of the brain have been disturbed. Otherwise, that is a normal baby with some delay, okay, in activities. Right. Um, Another cause could be jaundice. I remember when I was young, I didn't understand what jaundice was. I easily understood it as yellow fever, where the baby's skin and complexion would turn into yellow, eyes would be yellow, the skin would be yellow, the tongue would be yellow. I thought that was yellow fever, and yet that was jaundice. So this, I've seen it. I've seen that jaundice is quite hard to distinguish in babies who are of a lighter complexion, because most parents would think the baby is just light, and yet that is jaundice, because being having a lighter complexion and your skin turning yellowish may not easily be distinguished, unlike in darker skinned babies whose skin or tongue or eyes would easily show that this baby has got yellow coloration, and that would be an emergency light. Yeah, so other causes of cerebral palsy could be just trauma. You know, as we are having children, children are during the explorative stages, they are everywhere. They want to climb, they want to try out this, they want to eat that. So sometimes when a baby falls from a height, even just from the bed, I've seen instances where a baby was lying on the bed as they were rolling over, fell onto the floor, and then resulted in cerebral palsy. Sometimes we call it the shaken baby syndrome. You know, where the baby is crying, you pick up the baby, you try to soothe the baby, but as you are shishikaning the baby like that, you kind of shake the baby too much. That traumatizes the brain, and this, it disturbs the brain, and that could lead to shaken baby cerebral palsy, right? So cerebral palsy can actually happen at all these three levels. It could happen before birth, could happen during birth, could also happen after birth. Now, how are we able to identify that this baby has got cerebral palsy? It's very important to monitor your child. It's very important to take the baby for under five clinics, because sometimes we as parents may overlook. We might not always be with the child. Maybe we'll be coming back home and the baby is sleeping. We won't really monitor how the baby is growing, but if we take the child frequently to the under five clinics, would would be monitoring, or the healthcare givers would help us monitor our babies. And if any problem is identified, the sooner the problem is identified, the better. And once the problem is identified, I know we are in an African setup. Most of us would rather seek traditional intervention, which I do. I know we're African, but in terms of cerebral palsy, I would strongly advise that when we identify a problem in our children, we take them to the healthcare givers who would, I mean, they're there to help us when it comes to when it comes to health. So let us rush and take our babies to the health facilities so that we do not make things go worse. So how do we identify cerebral palsy? Cerebral palsy is easily identified using what they call a baseline. Okay, and these are the milestones of development. So the baseline is simply activities that a child does, or activities that a child is supposed to do according to their age. For example, a baby at 3 months old should have a strongish neck. A baby at 6 months old should be able to sit. A baby at 9 months should be able to crawl. A baby at maybe 10, 11 should be able to stand holding on to objects. Maybe at a year two should be able to walk independently, run, climb, like that. So using the baseline milestones of development, we will be able to identify delay in these children. Now, cerebral palsy sometimes could be a bit tricky, and can easily be misdiagnosed with delayed milestones. So these are two different things. There's delayed milestones and cerebral palsy. So today we are just talking about cerebral palsy. we'll come to delayed milestones in a different topic. Yeah, so when it comes to delayed milestones, we find that our babies delay in attaining certain activities. For example, our baby could be 4 months old with a very wobbly neck, right? Maybe our child could be 8 months old and they're not able to sit. Sometimes it can be observed in either their hands or their feet, where they always hold their hands in fists, or maybe they are always extended, or the legs could either be crossed. The muscle tone, the muscle tone, we call it tone. When you try to bend or straighten their hands, it feels so strong, like they're trying to resist. Those are tones which are not supposed to be in an unaffected child. So that tone could be a signal that there could be something wrong with this baby. So now, after identifying that there's a problem with my baby, what next? Is there any medicine or anything I can do to help my baby? Yes, two things, yes and no. Okay, I want this to be very clear. Damage to the brain is different from damage to any other body part, for example, the skin, or the bone. When you are cutting, for example, you're cutting vegetables and then you cut your finger, you bleed today, tomorrow, not even tomorrow, you just bleed maybe for a few minutes, and later on it's going to dry up. By tomorrow, it'll be fine. When you have a bone fracture, you might be put in a cast, what they call H2D, and you'll be there maybe for about a month or two, and the bone is going to mend. It's different from the brain. Okay, once the brain is injured, the damage is permanent. Okay, once the brain is injured, the damage is permanent. But then what can we do? But then you're saying the damage is permanent. How then is my baby going to be helped? Right. Because the baby is still new and the brain is still new, we can always, we physiotherapists, okay, physiotherapists can always help to retrain or to train the brain to function as nearly as, or could I say, as close to the norm as possible. Of course, there's no medicine that is going to reverse the damage, no, but exercises are going to help the child be able to achieve certain things that he or she could have failed to achieve had they not started physiotherapy. Okay, and the frequency of physiotherapy should be every single day. By me saying every single day, I don't mean you going to the health facility every single day. No, what I mean is that every day the baby should be exercised. Fine, you're going to go to the hospital, maybe you'd go there like twice or 3 times a week, or maybe once a week, depending on how close or how distant your house is from the hospital. When you go to the hospital, you're going to be taught some home exercises which you can be doing at home, and these won't take you a whole hour or 4 hours. No, it might even just take you 20 minutes, and that is enough for a day. Okay, so exercises done over a long period of time have shown to improve the quality of life in children with cerebral palsy. We find that in children who've been exercised more frequently, who are using some sort of assistive devices, maybe it's a sitting frame or it's a standing frame, we find that they are able, or they begin to be able to function at least as nearly to the norm as possible. I'm not saying that if the baby goes for physiotherapy, they are going to become perfectly fine. No, what I'm saying is that if the baby goes for physiotherapy, they are going to improve in such a way that they should be able to take care of themselves, or at least it should make you easier to carry them. You know, where the muscles are so tight, it's very difficult to put the baby kumsana kupapa because the muscles are so tight. But if the muscles are a bit flexible, you can easily papa the baby. Or even if it's using a wheelchair, you can't use the baby, you can't put the baby in a wheelchair with their muscles too tight. I mean, that is even a bit too uncomfortable on the babies themselves too. So physiotherapy interventions really assist so much. So in case we come across a baby who we think could have cerebral palsy, let's not take time to sit home. Let us rush and seek medical attention. Um, I'm sure we have more questions. I would be expecting to hear your views, maybe some suggestions or questions about this topic. I'm hoping that we are here to share knowledge and learn from each other. So from me, I'm going to say thank you so much for your time, and let's work together to make a better future for our babies. Thank you so much.